There's something I almost forget to ask.
Yeah.
We've talked about infertility, right?
Yeah.
How assisted reproductive technology can help. In the
Hmm.
case of sickle cell trait, how
Yeah.
can assisted reproductive technology help?
That's another thing. Yeah. So I talked about that genetic testing that only assesses chromosomal balance, right? Checking for aneuploidies. There's another pre-implantation genetic testing or diagnosis, right, that is usually used to diagnose monogenic diseases. So there are certain monogenic disorders that is peculiar with um, reproductive medicine. For instance, we have some couples who come to us. They are not infertile. They are normal. They're okay. All right. But then they've done their genetic assessment or genotypic assessment, and they've been determined to be maybe carrier of a deadly or debilitating disease like sickle cell. Right. Like I used to tell people, my wife and I we are both sickle cell carriers. Where we have the sickle cell trait, not that we have the disease. So I'm AS, my blood hemoglobin genotype is AS, my wife is AC. So she has a different allele strain. So right from the onset, before I got married, I was well bent on we are gonna have to do IVF if this marriage is going to happen, and we're gonna have to do that pre-implantation genetic testing for monogenic disorders like sickle cell. And somehow, I mean, my wife agreed and said, no problem, we'll do that. But when the time came, I mean, we just got pregnant, we didn't even know. But we're thinking that if worse comes, if push comes to shove, even if we got pregnant, we eventually have a sickle cell baby, then we'll consider other treatment, alternatives like bone marrow transplant, um, all these CRISPR technologies now happening, although still, in progress. I would probably need to consider that. But I mean, as God would have it, both our kids did not have the sickle cell disorder. We were just lucky, maybe. But
Yeah.
that was the basis of my doctoral program. I was trying to design a technology for myself that could help me identify sperm that probably has sickle cell or some other kind of genetic disorder. It's not just sickle cell, there's also cystic fibrosis, which is common in the Caucasian population. Sickle cell is just common in the African population or African American population. Back in the day, the statistics used to be at least 1 in 4. Yeah, if I get it, 1 in 4 people has the sickle cell trait in Nigeria, right? So that's why they always recommend know your blood genotype before you get married. If you're AS, they'll tell you not to marry another AS. If you're AC, don't marry another AC or AS. So, but me, I'm in the field. I'm knowledgeable about it. I know what I can do not to have such pregnancies. But then it also comes down to affordability. It's not that cheap. You trying to do that kind of technology, it's not. It's one thing to raise embryos. That costs like 2, 3 million naira in Nigeria, for instance, or $30,000 in the United States. And after that, you now go to the level of PGT for monogenetic disorder diagnostics. That's another 3 million naira in Nigeria again, like close to a total package of 7 million naira to get IVF and do genetic testing. How many people can afford that? You have to be super rich. And it's not that when you do it once, you achieve success once. You might be doing it 2, 3, 4, 5 times before you get the required result you're looking for. So who has 30 million naira between IVF and PGT up until when they're able to get a normal, healthy birth? So it's difficult. So and it's not readily accessible. So I was thinking of a technology that I could do, right, which is was the basis of my PhD studies, that I could actually select sperm and tag some of the expressed proteins with certain monoclonal antibodies that could help me delineate which sperm has a sickle cell gene, which doesn't have a sickle cell gene. I was also used another model in cystic fibrosis. Then we also did X-linked disorders because there are some genetic disorders that are also ascribed to the content of the X chromosome, which is usually, definitely from the mother, and the father can also contribute that. For instance, some people that have the blood clotting factor, hemophilia, and other diseases, they also come to us for IVF because they've had an history of that in their family. They don't want another child that'll come down with that. That'll come down with that. So we actually can help them select the embryos via that genetic testing protocols that would tell us the information on that embryo before it is being transferred. So we can know which embryo has sickle cell, which one is us the carrier, which one has hemophilia, which one has cystic fibrosis, which one has, just about any kind of genetic disorder that has been probed, right, that has been previously worked on. We can pretty much do that as well, even in our assisted conception protocols as well. All right.
Good. Good. Thank you. Thank you for sharing that. That's very
Yeah.
powerful.